Hello, I'm Dr. Barry Levin. I'm an anesthesiologist and an intensive care medicine doctor. I work in Metro South Hospital in Blue Island outside in the Chicago metropolitan area. Well, I spend half my clinical time as an anesthesiologist doing general anesthesia in the operating room, and I spend half my time taking care of patients in the intensive care unit. At our hospital we have two 14-bed intensive care units, a medical intensive care unit and a surgical intensive care unit. I spend my time as an ICU physician in the units themselves, attending to these patients. Well, it's had a tremendously positive effect for me. Number one, in the intensive care unit, where things seem to be sort of chaotic. It's very easy for me to find myself an open computer and then have access to all the information that I need. It was very common for doctors in the ICU. I suspect not only the ICU, but over the hospital in general, to locate a chart, to locate the nursing records and other information pertaining to the patient. So it's been, all the information is very easily accessible to me in that regard. You don't spend, on every single patient 5 or 10 minutes hunting down a chart, hunting down the data chart, the nursing vital sign chart that's separate from the patient's chart at our hospital, how our hospital was previously to Empower, and in many hospitals that I've been. It's a tremendous time save. There's really been no downside. I think that there's a tremendous decrease in there's a tremendous decrease in miscommunication, misunderstanding, when you're able to recognize and read clearly a colleague's input in the record. By nature of the ICU, patients are sicker. They're more complex in their illness, and there's many more variables and much more information, I think, that one needs to glean from the records. And so, it's been a tremendous help to have all that information at just accessing and clicking a mouse. I've been able to go from patient history, notes, laboratory, nursing records, just by clicking the mouse and having it quickly come up. Physician input, of course, is important. Physicians are the ones that are using it, and for that matter, nurses, who play a large part in data entry. Their input, I think, is important. Being used to electronic record keeping, it was a slam dunk for me. I was very positive on it from the get-go. The system, for me, works it's extremely intuitive. It seems very fluid. Many examples of patients that come into the intensive care unit without much warning. A patient may deteriorate fairly quickly. There's a quick decision to admit the patient, and within minutes a patient rolls into my ICU, and I'm able to very quickly sit down at the computer terminal, just feet away from the patient, and access fairly quickly all their information, previous notes, without even having their chart now accompanying them. Although they do have a chart, there's information in that chart as well, but every information that I need to clinically care for that patient is there at the computer. So, there's been multiple examples of that. Sure. Where I access labs, I access nursing notes, physician notes, very quickly. There's a broader advantage as well to have everything on computers, and that is that data collection for us, I think, is going to be a tremendous positive for patient care and an efficiency of physician and nursing care.